Low back pain or lower back pain. Low back pain is the most common source of pain and disability in modern society. Spinal pain disorders cost billions of dollars every year. Low back pain is the fifth most common reason for physician visits and the second most common symptomatic reason to see a physician. 50 to 80% of adults experience low back pain. So it's clear that low back pain is a very common problem. Now let's talk about the risk factors of developing low back pain. Some risk factors of developing low back pain include poor physical fitness, a sedentary lifestyle, certain occupations that involve prolonged sitting and continuous vibrations, repeated heavy lifting, hard physical labor, obesity, depression, and genetics. Low back pain is categorized as acute or chronic. Acute pain typically resolves within 3 months, while chronic pain lasts longer. Transient acute pain is brief and often activity related, and most individuals don't seek medical care unless it becomes frequent or difficult to manage. Chronic low back pain lasts beyond 3 months and can continue for years. It may lead to chronic pain syndrome, which is often associated with personality and psychosocial challenges. Causes of low back pain. Causes of low back pain can be classified as mechanical low back pain, non-mechanical low back pain, and visceral disease. Mechanical causes of low back pain include muscle strains, often caused by overexertion or improper lifting techniques. Herniated discs. Bulging or ruptured discs can compress nerve roots. Spinal stenosis. Narrowing of the spinal canal can increase the pressure on nerve roots. Arthritis. This is degenerative changes affecting joints and discs. Non-mechanical causes of low back pain include tumors. Malignant growths can exert pressure on nerves. Inflammatory conditions like ankylosing spondylitis can cause chronic pain. Infections such as osteomyelitis or discitis can result in lower back pain. Visceral causes of low back pain include kidney stones. This typically causes sharp pain, often felt on one side of the lower back. Endometriosis is a pelvic disease that can cause back pain linked to menstrual cycles. Gastrointestinal disorders like diverticulitis and peptic ulcers can refer pain to the lower back. Now, let's talk about the most common cause of low back pain. The most common cause of acute low back pain is lumbar strain or sprain, while chronic low back pain is most commonly caused by disc herniations and degenerative disease of the disc and the facet joints. Most patients experience mechanical low back pain or musculoskeletal pain, which comes from muscles, tendons, ligaments, bones, discs, and joints. In fact, 99% of back pain is musculoskeletal, typically caused by strains or acute disc injury. Only 1% is non-mechanical, where the low back pain is caused by a serious underlying disease. Conditions that can cause this type of pain include infections like epidural abscesses, cancers that spread to the spine, osteoporotic fractures, autoimmune disorders like ankylosing spondylitis, and nerve injuries from herniated discs. The history of your lower back pain helps determine how urgently you need treatment. It's important to identify non-mechanical low back pain and rule out red flag conditions, which could be life-threatening or cause paralysis if not treated quickly. These red flags include recent severe trauma, like a motor vehicle accident or fall from a height. 2. Mild trauma or strain with a history of osteoporosis. 3. Unexplained weight loss. 4. History of cancer. 5. Fever. 6. Pain worse at night or at rest. 7. Bladder or bowel dysfunction. 8. Intravenous drug use. 9. Back pain not relieved when lying down or that wakes you up from sleep. Low back pain that is described as severe or excruciating may indicate a new fracture, infection, or metastatic disease. Low back pain typically radiates to the buttocks, hips, groin, and thighs. Pain that radiates below the knee into the lower leg and foot suggests nerve root compression. Pain usually varies throughout the day. However, if the pain is consistently severe, especially at night or when lying down, it may indicate a serious underlying condition. Back and leg pain that worsens with walking but improves when sitting or leaning forward, often referred to as the grocery cart or shopping cart sign, suggests spinal stenosis. Mechanical back pain from spondylosis typically worsens with activity and improves with rest or lying down. Prolonged standing or sitting can also aggravate this type of pain. Muscle weakness or sensory loss in the legs, along with bowel or bladder dysfunction, indicates nerve root compression. See a doctor immediately. Unexplained weight loss, fever, persistent pain, and pain worsening at rest or at night raise concerns for cancer, especially for those aged over 50. Low back pain with fever, new leg weakness, or bowel or bladder dysfunction may suggest a spine infection, particularly in those with diabetes or a recent history of surgery. Stiffness and chronic fatigue with lower back pain may indicate an autoimmune disorder like ankylosing spondylitis. Diagnosis. When you present with these symptoms, your doctor will examine the painful area and assess your range of motion and walking. She will check muscle strength, reflexes, and sensation in your legs, along with your pain history and related complaints. Based on the examination findings, the doctor will make a preliminary diagnosis and determine if additional tests, such as X-rays, CAT scans, MRIs, or blood tests are necessary. Treatment. Treatment for acute musculoskeletal lower back pain is typically conservative and includes rest, physical therapy, over-the-counter pain medications, and non-invasive methods like massage and chiropractic adjustments. Most cases resolve within 6 weeks. If back pain lasts longer than 6 weeks without improvement, it's important to see your doctor. Pain that persists for more than 3 months is classified as chronic back pain, often caused by lumbar disc disease, which includes disc herniations and degenerative disc disease. So, what is lumbar disc herniation? Lumbar disc herniation or rupture usually happens due to trauma, whether mild, moderate, or severe, and can also result from repetitive minor injuries over time. It's actually the most common cause of chronic low back pain. Most often, it's the L4-5 or L5-S1 discs that are affected, and you typically see this issue in people in their 30s and 40s. Back injuries and lumbar disc ruptures can often come from things like improper lifting techniques. Even repetitive bending, twisting, and lifting lighter things can weaken the discs over time. Plus, factors like aging, obesity, and poor physical conditioning can increase your risk. Symptoms. Herniated disc symptoms can range from mild to severe lower back pain that may radiate down the leg and may be associated with numbness and weakness in the leg. This is known as sciatica. Less than half of patients experience true sciatica. However, this may develop years after the original injury. Activities like coughing, sneezing, or sitting and standing for long periods may make the pain worse. If you have these symptoms, see your doctor. Diagnosis usually involves an MRI, CAT scan, or myelography. Next, we will talk about when you need to get an imaging study done for your back pain. Imaging becomes part of the clinical evaluation for back pain when one of the previously mentioned red flags symptoms are present. This includes significant recent trauma, unexplained weight loss, fever, steroid use, and a history of cancer, especially in individuals over 70 years old. If any of this is present, it is important to rule out serious underlying conditions with imaging such as X-rays, CAT scans, or MRIs as determined by your doctor based on the clinical situation, such as 1. If you're over 70 years old and had a recent fall, your doctor may order an X-ray to check for fractures, especially with osteoporosis. 2. If back pain lasts longer than 6 weeks. 3. If back pain is persistent and doesn't improve with rest or common treatment. 4. If back pain is accompanied by symptoms of nerve involvement like numbness, tingling, or weakness in the legs or feet. This is called sciatica. 5. If there are signs of cauda equina syndrome such as progressive leg weakness, bladder or bowel incontinence, or difficulty urinating. 6. Evidence of myelopathy, which is indicated by back pain with exaggerated reflexes, muscle spasms, or a stiff gait. However, serious conditions are very rare. Only 0.7% of back pain patients have metastatic spine cancer. 0.01% have spinal infections. 4% have osteoporotic fractures. And 0.3% have ankylosing spondylitis, known as bamboo spine. Imaging for lower back pain is commonly done using plain X-rays, CAT scans, MRIs, or myelography. Your physician will choose the appropriate study based on your condition. An X-ray is often the first choice due to its simplicity and low cost. It shows bones and joints and can diagnose fractures, osteoporosis, joint dislocations, and conditions like osteoarthritis. A CAT scan is more expensive but offers greater accuracy, especially when combined with a myelogram that uses contrast to highlight soft tissues like the spinal cord, nerves, and muscles. An MRI is the best choice for diagnosing spine disease and can be combined with a myelogram, especially when surgery is being considered. Things to note about the results of imaging of the spine. Imaging studies often show significant abnormalities that can be asymptomatic. For instance, 30% of patients aged 50 to 60 and 75% of those aged 60 to 70 have disc tears on MRI and do not have any symptoms of back pain. About 25% of patients that have significant lumbar disc abnormalities on myelography and 35% of volunteers that have abnormal lumbar scans do not have any symptoms. Overall, 1/3 to 2/3 of patients that have lumbar spine abnormalities on MRI studies do not have any symptoms. Common findings like disc tears, bulges, and mild misalignment of the vertebrae, a condition called spondylolisthesis, are usually asymptomatic, while severe conditions like disc extrusion, nerve compression, and spinal canal stenosis are more likely to cause symptoms. So finally, we've come to the most important question. When should you worry about your lower back pain? You should see your doctor as soon as possible if you have back pain with any of the following conditions. 1. If back pain lasts longer than 6 weeks, it may indicate a serious issue beyond a low back strain. 2. Persistent or worsening pain over 6 weeks requires evaluation to rule out serious conditions like osteomyelitis, discitis, or spinal cancer. 3. Nighttime back pain, especially if continuous, often signals a serious underlying condition warranting a doctor's visit. 4. New back pain after age 50 without known injury or cause should prompt evaluation for cancer or osteoporotic fractures. 5. Back pain accompanied by fever and night sweats may indicate an infection such as tuberculosis. This is called pot disease. 6. Unexplained weight loss with persistent back pain requires investigation for potential spinal cancer, especially if pain worsens at night. 7. Severe spine stiffness, particularly in the morning, may suggest ankylosing spondylitis, which can be diagnosed with an X-ray. 8. Back pain with symptoms of nerve injury, like bowel and bladder dysfunction or leg weakness, necessitates evaluation for cauda equina syndrome to prevent paralysis. In summary, lower back pain is a common issue that usually isn't serious and tends to resolve within a few weeks. In fact, only about 1% of back pain is linked to serious disease. I hope the 8 warning signs I share here will help you know when to seek medical advice. Thanks for watching and take care of your back. Please note that the information provided in this video is for educational purposes only. It is not medical advice. See your doctor for medical advice. Thank you.